All right, let's look at the wrist and hand region. First, we'll look at the joints. We have the radiocarpal, or what we call the wrist joint. Uh, Two planes of motion in the radiocarpal joint. We have flexion and extension in the sagittal plane about the medial lateral axis. And we have AB and adduction in the frontal plane about the anterior posterior axis. We also call the AB and adduction at the wrist joint or the radiocarpal joint ulnar deviation, so towards your pinky side, or radial deviation. We also have the carpometacarpal joint of the thumb. So that's between the carpal or the trapezium. Remember, trapezium under the thumb and our metacarpal. And that is a saddle joint. Huge range of motion, which you can probably do as you're sitting there right now. Move your thumb around. Then you have the metacarpal phalangeal joint. So that's between the metacarpal bones and the proximal phalanges. And then we have our interphalangeal joints. It looks like a lot, but basically metacarpal phalangeal and interphalangeal are reasonably straightforward. So radiocarpal, as I said, we have flexion and extension about in the sagittal plane about the medial lateral axis. And then we have abduction, which is radial deviation, and adduction, which is ulnar deviation in the frontal plane about the anterior posterior axis. Then going to the carpometacarpal, that is a saddle joint. So remember, a saddle joint has the concave and convex surfaces on both sides of the joint, which increases its range of motion. So this joint can do flexion extension, AB and adduction, and what we call opposition. And opposition is when you touch your thumb and your pinky. So here's a view of the CMC or the carpometacarpal joint. You can see the saddle joint there. It has a large range of motion. The thumb is interesting because if you just stand in anatomical zero, naturally, your thumb will be anterior to your palm. So it's basically 90 degrees out of phase with the metacarpal phalangeal joints. So your thumb can flex and extend, AB and adduct, and do opposition, but it flexes and extends in basically the frontal plane. It AB and adducts in the sagittal plane, and then it has this opposition of putting your thumb with your pinky. Metacarpal phalangeal joint, or the MCP joint. So that's metacarpal to your proximal phalanges. It's between your palm and your fingers, quote unquote, your knuckles, right? That's the joint, your knuckles. It can flex and extend in the sagittal plane about the medial lateral axis. The MCP joint can also AB and adduct. So AB is away from the midline and adduct is toward the midline. And remember, the midline for your hand is your middle finger. Then we have interphalangeal joints, so between the phalanges or the movement of your fingers, which can basically extend and flex. And that is in the sagittal plane about the medial lateral axis. So these slides have a different view of the wrist and hand joints. One thing to note that the axis of rotation is through the capitate, right? So that's for the AP axis, and then you can see here your medial lateral axis. So again, 2 degrees of freedom at the wrist or the radiocarpal joint, which is flexion extension, and AB and adduction, which we call at this joint ulnar and radial deviation. You can also see your from proximal to distal, your carpometacarpal joints. The big one is your thumb joint, the metacarpal phalangeal joints, aka your knuckles, and those have 2 degrees of freedoms because they can flex and extend and AB and adduct. remembering that the midline is your middle finger. Here's a detailed view of your base of your thumb, so your carpal metacarpal joint, and it has the concave and convex on both sides. So it is the definition of a saddle joint, which has a great range of motion. And again, it can AB and adduct, flex and extend, and it is 90 degrees out of phase. Your fingers, your proximal, distal, interphalangeal joints can only flex and extend in the sagittal plane. And just note that your thumb does not have a PIP or a DIP. It only has one interphalangeal because it only has two phalanges. So here's some more, your distal interphalangeal joint, your proximal interphalangeal joint, metacarpal phalangeal joint, and carpometacarpal joint. And it's just the joint names are just what bones it's between. Here are your carpals and your metacarpals. So the joint in between it is the carpometacarpal. When you're between a metacarpal and a phalangeal, it's the metacarpal phalangeal. And then interphalangeal is because it's between two phalanges. So some ligaments. We have the radial collateral ligament or the lateral collateral ligament and the ulnar collateral ligament or the medial collateral ligament. Don't get these confused with the ulnar and radial collateral ligaments at the elbow joint, right? Anatomy is usually pretty simplistic. It's just saying what the ligaments attach and what side it's on. So collateral on either side, one's on the ulnar side and one's on the radial side. This is a dorsal view, so kind of the back of your hand view. And so we have the dorsal intercarpal, so between carpal ligaments, kind of pushing those together. And then we have the dorsal radiocarpal ligament from the radius to the carpals. Again, it may seem overwhelming, but ligaments are pretty straightforward because their names are just what they're attaching. So when we look on the palmar side, it does look a little bit more chaotic. You can see we have the radial collateral ligament, the ulnar collateral ligament, and then we have the palmar radial carpal ligament. So palmar radial carpal goes from the radius to carpal bones. The palmar intercarpal ligament, so that's on the palm side, but a ligament between carpal bones. And then the palmar radial ulnar ligament, which goes from the radius to the ulna. We also have the triangular fibrocartilage complex, which has an articular disc at the bottom of the ulna, and then it has the palmar ulnocarpal ligament, so from the ulna to the carpals, and then the ulnar collateral ligament.